Part of the misconception with the hospice is that it's only for the patient that's only got a few days to live. It's actually a big part of the healthcare continuum. And a lot of times what you'll see is that a doctor will recommend hospice to come in because they want the family to be able to prepare and to enjoy the time they have together. And that way you have a nurse that comes in, and you have the caregivers, the social workers, the ministers that come in and talk with everyone to make sure that then they can enjoy their time together. A lot of times people think you just bring them in the last few days. The resident, the patient, is about to pass away, but it goes much deeper than that. It's how you can care for them, how you can make this time for the family to enjoy each other, to take the relief off of what is happening with the resident and to put it more on how the family can come together and enjoy each other and have almost a family reunion together at that time. I know it seems a little bit sad, it seems a little different that people think of it that way, but if you sit back and realize as a natural part of life, you want to then have a family reunion to be able to talk, enjoy each other, and let the professionals of hospice handle what they're there to do.
Hello everyone, we'd like to welcome you to Real Talk. I'm your host, Pat Terrio, and here's another part to the series of A Day in the Life of a Nurse. We're here at Fairview Park Hospital in the critical care unit with two amazing women who do this job effortlessly. We're going to speak with them today. They're going to tell us about themselves, and we're going to go a little bit in depth about some specific things that they do as far as patient care. How are you, ladies?
Good.
Doing good, doing good.
Very good. Nice to see you both. All right, now listen, we want to talk about some things, right? But first we want to know about you. All right, so let's start with you. How are you?
I'm good. Hi, my name is Mandy Sweat. I'm a critical care nurse here at Fairview Park Hospital. I started out on the 4th floor and stayed there 4 years, and I've been here since July about in the CCU. I am also in school at Georgia State College getting my master's degree as a nurse practitioner. So
Congratulations.
I have a year to go before graduating, and I just got engaged.
Oh my gosh,
Saturday.
look at that. That is so beautiful.
Thank you.
How did he propose?
Well, it was kind of unexpected. It was a huge shock for both of us, I think.
But that's
he
wonderful.
did get permission from my father and all, so.
Oh, the good old-fashioned
Praise
way.
to
You
him.
know
He
that.
did.
That's
He did.
wonderful.
Good job.
And so congratulations to you.
Thank
And
you.
here you are, you're continuing your education to become a nurse practitioner. How has your experience been here working in the critical care unit?
Oh, it's been wonderful. I have learned so many. It's just a different aspect of nursing. I've been used to less critical patients on 4th floor, which was a great starting place. I got a good foundation of nursing starting there. But I've come back here and I've learned how to deal with more ventilator patients or different kind of blood pressure problems on different drips and things like that.
So when you
it's
say the
been
4th floor, what is that?
it's a medical surgical floor.
Okay, okay, very good. And now you've transitioned.
Yes, ma'am.
All right. Hello, young lady, your turn.
Hello. Hey, I'm Tammy Thompson. I am an RN also, and I work in the critical care unit. I'm also the clinical coordinator here. I started here back about 12 years ago. I started as a nurse tech, worked my way into becoming a nurse. Had a lot of good leaders that showed me how, and also I have 3 wonderful children, and I'm married.
Nice.
Yes.
How old are your kids?
They're 16. One of them's about to be 14 next weekend, and then I have a 7-year-old.
You go, girl.
Yes. I'm also in school as well, working on my bachelor's degree. So hoping to get that done by next year.
Congratulations to you.
Yes.
So here you ladies are. You're working full time. Your mom's about to be a wife soon, you know, and you know, and you're going back to school to get, you know, more education, which is fantastic. Now let's talk about what your job specifically is here as the clinical coordinator. What does that mean?
That means that I basically oversee all the nurses and make sure that the quality of care is being monitored and making sure that everybody is doing what they're supposed to do. I also do nurse leader roundings every day on every patient to ensure that their care is being provided, and if there's any opportunities for improvement, we do offer the patients feedback.
Right. Okay. Very good. Now, so Mandy, what is a typical day like for you? I mean, when you know, just coming in here and looking around, how many patients can you house here? Is this ICU as well as CCU?
It is, yes, ma'am. We're at 16 bed, and the ICU is kind of split 8 patients on each side. We usually have anywhere from 1 to 3 patients per nurse, just depending on acuity and staffing. So it really all depends on what you walk into as to how many patients you're going to have. But
Okay.
we usually come in, hit the door running.
Oh, I bet you do.
It's busy.
Well, because when you think of critical care, CCU, as a family member, you're like, you know, you have all this feeling that you have, you know. So what type patients do you see when you're here? Because I know it runs the gamut of different types of issues.
Yeah, we get a variety of patients. We get anywhere from heart patients to septic shock patients to diabetic patients. We also deal with some of our psych patients. We do manage and take care of them. We also take care of
Let me ask
our
you this.
vent patients.
Vent patients.
We do a lot with vent patients.
How do you know when a patient needs to go to CCU? Like, what is there a certain sign, you know, or when you're doing some type of assessment to where you know a patient needs to go to a critical care unit?
Well, from my standpoint as being a 4th floor nurse originally, we on the 4th floor you can have you can take a heavier load because the patients aren't quite as critical. When you get that patient who their blood pressure may need to be monitored a little closer, or they're having a change in mental status or something like that, something more critical going on, that's a flag to us to call the doctor and let them know what's going on. And usually they'll get them back here to get that, just so you can watch them a little bit closer.
Okay, so when the doctor says, okay, this patient needs to be here, what takes place?
What takes place?
Like when you get a patient, like what is the first thing you have to do?
We get the room prepared for the patient. We go ahead and contact the doctor and let them know that the patient's on the way. We go ahead and assign the nurse who's going to be taking care of that patient. And even though that one nurse is assigned to it, we all work as a team to get that patient in and get that patient taken care of. So it's really not just, you know, one person taking
it's
care of that
several different
patient.
people.
We all work together as a team.
And that's good. So speaking of team, how many people do you have on this team? Like, do you have a certain number working at each shift, or?
Generally, we do a 2 to 3 patient ratio per nurse. Depending on the acuity of the patient and what's going on with the patient, the nurse may not take care of as many patients. It may just be 1-on-1. Sometimes it's 2-on-1. It just depends. We all try to work together and decide, you know, depending on how critical that patient really is.
That's good. And Mandy, you know, you talked about being a 4th floor nurse. Do you think that your experience that you gained from being on the 4th floor, does that help you?
Oh, most definitely. Yes,
and what kind of ways does that help you?
I gained a lot of my assessment skills from working up there for so long.
Surgical floor?
Yes. You see a good array of patients up there, anywhere
Okay.
from pneummonia, surgical, just any kind of cardiac issues, just milder. So you get your assessment skills down for sure working up there first.
How do you girls, you know, is it okay to call you girls? Yeah. Like we're girlfriends. I'm like, how do you girls, how do you, because you can get so many, this is critical care. So how do you kind of keep your sanity when you have patients in whatever condition, and you have to talk to the family members, you know, and sometimes family members aren't always in the best condition themselves when they have a loved one up here. How do you keep calm? What do you do to keep your balance, to keep your sanity in order to be able to care for these patients and be there for their family members?
I think we just work with each other, and, you know, we try to help each other out and look, you know, for guidance from other nurses and try to be supportive. And our doctors here are wonderful. They're very supportive of us. And, you know, when there's a problem, we have a wonderful pharmacist who, you know, when there's a critical patient and they need, you know, the family just needs some of that support, that he's always there looking after them, praying with them, just going out of his way above and beyond that we can't, you know.
Yeah.
We just
Can't
think
even,
He's just great.
That is so good that you said that, you know. And have you had situations where it's been kind of tough for you, you know?
It has. And a lot of times you just have to put the shoe on the other foot. What if that was your mother, your grandmother, your aunt, your uncle, and laying in that hospital bill? How would you feel at that time?
Yeah.
Because a lot of family members and patients get overwhelmed. They're
Yeah.
sick. They may not be used to being sick. That's just different for them. So, I mean, you have to learn to cope and see how you would act in the same situation. It's not...
Absolutely, and it's so true. And you said you've had family members up here that you've had to care for.
I actually did. I was on the flip side of things, and I was actually the family member of my mother-in-law. She had come in and she had had chest pain, and so I had to be on that end of it. And I realized the important things, you know, as a family member.
Yeah.
You know, those people, that kind face. Those people explaining things and just being supportive means the world. You know, you don't really understand how important those little things are, but they really do mean a lot.
Absolutely.
They're really
and everything, and you know,
important.
and the family members, they hang on to every word that you say.
absolutely.
You know, every word.
Yes, because it's important. You know, they're scared. They don't know what's going to happen next. And so we do try to make sure that we communicate with them often and let them know what's going on, and, you know.
And how long does, like, is there a typical time frame that a patient is here in CCU?
Well,
Does it depend?
it kind of varies on how critical they are. Different things change, you know, different level of care. So,
Okay. So it depends.
usually, it all
It depends. Okay. Well, you've got a lot of equipment up here, and we kind of want to do a little tutorial, a little scenario here. So we want you to kind of talk me through it as you talk them through it. Let's talk about what you're going to show now.
Okay. All right, when we get a patient in the unit, we go ahead and we hook them up to the bed. We hook them up to our heart monitor. We hook them up to a blood pressure cuff. We go ahead and access any additional IVs that need to be put in place.
And that's the purpose of all this equipment.
Yes.
That's the monitor
yes,
up there.
the heart monitor, which monitors their blood pressure, their heart rate, their oxygen level. And then back here is our pump, and we actually hook them up to fluids, any antibiotics, any kind of drips that they're needed.
All right, so when we come back, I'm going to be your patient, and we're going to kind of talk through some things, okay? Are we ready? All right, we'll be back in just a moment. Okay, ladies and gentlemen, I am here with Mandy, and she's already started the process of heart monitoring me, right? So, Mandy, we'll let you talk and kind of explain to them what you're getting ready to do.
Okay.
Wait for a second. Go ahead and talk to us.
Okay, when a patient first comes in the ICU, we always get them in the bed, get their height, weight, and one of the first things we do is get their vitals. By doing this, we go ahead and attach these little sticky probes to the chest in certain areas so it can monitor the heart rate and rhythm, which we have already started doing.
Okay. So we'll go from here. I got this. All right, go ahead and talk.
Alrighty, so we've started the chest. We will go ahead and finish putting the probes on. And meanwhile, you can always tell if one of these stickers comes off anytime during the day. This is monitored 24/7 while you're in the hospital. Up on the monitor, it picks up the heart rate. If one of the leads come off, it tells you which lead has come off, which lead is not picking up appropriately, so you can come in and fix it so you're getting an accurate picture of the rhythm of the heart.
Okay.
Okay.
That's cool.
It's cold.
Showing all my flab. So impersonal up here.
Sorry.
You know, so now what type patient do you normally have to hook up to this, or does it matter?
It doesn't matter. Back here in the ICU, everybody gets hooked up to a heart monitor.
Okay.
That is one of the criteria back here. We always have you hooked up to the heart rate and rhythm. We have a blood pressure cuff on you, and we also measure your oxygen levels. That is bare minimum. When you are getting more critical, we can start different things called a radial line, which, let's get this on.
Okay.
There you go. Which is always, it's called an arterial line. We usually start it in the radial artery, which is your artery right at your wrist. They make, they get a needle to stick here and go straight into the artery and monitors your exact blood pressure. So if for some reason the monitor's not picking up really good, you know, when you're critical and your blood pressure's going up and down, that is a surefire way of getting
the
blood pressure. It is. And that also picks up on the cardiac monitor. And if you look, your heart rate is picking up now, your heart rate and rhythm.
Oh, wow.
Yeah.
Is that like 74 beats per minute?
It is, yes. Okay, and then the next thing, we always, usually, a majority of the patients who come up here are admissions from another floor or the emergency room, so they usually have an IV site when they get here. If not, that is always a priority also. Depending on different diagnosis,
Right.
you may be on antibiotics, you could be on different fluids, you can be on medications to keep your blood pressure up or down, whichever be the case. And we use these IV pumps to do this.
Okay.
And we are now, these are actually smart pumps. We enter the patient's medical record number in
Okay.
there, so that way it automatically sends information so they can monitor, hey, this pump was beeping for this long,
Okay.
and things like that. That they kind of check to see how to update the pumps. See
Okay.
if it'll help us any at all.
Very good. And so, it doesn't matter what patient you are, these are things,
These are the bare essentials.
The bare
Everybody
essentials.
has them.
okay, now that was a beep. What was that? Was that me beep? That was unrehearsed. I'm beeping.
No, this is actually a delay.
Okay, very good. And so, so what about the ventilators?
A lot of times, patients, if they come from the ER, sometimes they'll be on the ventilator or surgery. We have those that respiratory does a great job at maintaining. They are also set in the room at bedside.
Right.
And then the patient lays here. They have, of course, we have the tube. I'm not sure if we don't have one in here. Now they have the tube in their mouth, and we always have this headgear. People walk in and it looks like
It's terrifying.
It is
You know,
terrifying
it's
because you
terrifying.
have all of these cords, everything's hooked up to you, and then you have this big headgear. But the purpose of that headgear is to hold that intubated tube in place so it doesn't move.
Okay.
So that way we know it's in the appropriate place in the lungs.
And so, like for family members to see this, do you explain all of this to them?
I
so that
usually
they'll-
try to, yes. When they first come in, I try to take my time with the family members and go over each wire, each tube, each machine. That way, it's not so scary when you walk in. Because, I mean, it does get frightening when you walk in. You see somebody you care about with all of this connected to them.
Right.
A lot of times, their vital signs are terrible. They look up there on that monitor. It scares you. So we do try to take time with the family to explain things as well.
Are the patients always cognizant of what's going on?
No,
Okay.
a lot of the time on the ventilator, majority of the time, more so than not, then they're on different kind of medications to keep them kind of sedated so they'll be comfortable and not fight to try to get the tube out. A lot of time, if you're really anxious as well with a ventilator, your oxygen levels are not as good. So we try to keep you calm. This
Okay.
one goes on your finger
Right here.
Yeah. This is another when you're on the ventilator. Also, we keep this on the finger. A lot of times people, maybe their hands get real cold, we can put
Right.
it also on the earlobe. But it picks up your oxygen level, which displays on the monitor as well.
Where's my oxygen level
It's
at
at
now?
100%. It's the number on the very bottom.
Oh, great.
And you can tell if it's picking up. It
My
has
heart
a
rate's
heart rate
going up,
that it
isn't
should be. Are we making you nervous?
Probably because all these tubes. I have to call somebody in for me right now, just from the tubes
You're
alone.
in the right place. At
I am
least.
in the right place. And so, you know, the fact that you say all these things are going on and the family members are there and you're being very cautious with what you explain to them so that they have an understanding of what their loved one is experiencing. Now, are family members allowed to stay in here for all of these procedures or?
No, ma'am. Usually when we get a patient up, we ask the family if they will to wait maybe 10-15 minutes just at least so we can get everything set up and hooked up, you know, and get the patient stable is the most important thing. We always make a patient the priority first off, you know, to make sure
Right.
they're stable. And then we go out, get the family, ask them to come back and then explain everything so they'll know more of what's going on.
And we think that's very important when you talking about that you explain everything because, you know, family members have to have an understanding. Even though they may not understand everything that's going on, the fact that you're taking the time out to talk to them about everything that's transpiring,
That's right.
that still gives them a sense of comfort
That's right.
in the midst of the storm that they're facing.
It is. And a lot of the times, too, you have to think patients that come in that may not be alert or oriented or responsive, those family members are the ones that will be making the decision for the patient. So it's important that they understand what's going on.
Well, you know, just from personal experience where my family, you know, were in this dilemma of having to make the decision about my sister when she was up here.
Yeah.
You know, that's a very difficult position to
It
be
is.
placed in,
It
especially when you love that person and when you see them. And I think that what my family said was just seeing her with all of the tubes all over it, and just hearing how she was breathing, how difficult it was to witness, you know, and it's like those are crucial decisions that a family has to make.
They are.
And so
really are.
we're glad to have people like you, people
Thank
like
you.
Tammy and other members of the staff here in place to be a comfort to the family members.
Yes, that's one thing I can say about the CCU here at Fairview. We do work as a family. We work as a team. I'm just as close with the staff up here as I am to my own family. We have a great support system, and we try to transfer that on to family members and patients as well, because it's a hard time, if any time, being admitted to the hospital. So
It is. And, you know, and I tell people, like, just even with us going through this now, I'm feeling some type of way.
yeah,
You know, honestly,
It
I'm feeling
does,
some type
yeah.
of way about being up here just with this right here. And so thank you.
you're welcome.
Thank you, Mandy, for what you do and the expertise and the work that you do and how you do it. So is there any other equipment you want to explain while I'm on the table hooked up?
We can. The bed actually is a huge part of our
This
equipment,
bed.
believe it or not.
Look, I'm just laying on.
Monstrosity of a
Yes,
thing.
yes.
But these beds have a lot of different capabilities.
Right.
They have what we call CPT, where you can. It's something. I think you've heard it earlier when you come in. It
Made me nervous.
It's just constant shaking, but what it does is break the secretions up in the lungs, so they can be. They can be coughed up, so they can get out, so they're not sitting in there causing worsening pneumonia, or if you have pneumonia, it helps break it up.
Because they're not
So
able
you're
to
not,
move.
getting up, moving around. That's one way of doing that. They do the percussion.
That is so amazing, you know, to have, you know, this type technology.
It is, and they also, being you can't get up and walk a lot back here, the bed's actually transfer into a chair. So the foot drops, the head goes up, and it's like you're sitting more so in a chair than laying in a bed.
So what do you see, like, through the years of being a nurse? There's different things with the technology and how that helps you to be a better nurse with what you do.
Technology is wonderful. It helps us a lot up here, and we've actually come a long way at Fairview. We're constantly growing. We're getting new equipment. We actually just got the new updated IV pumps and all, so we're really excited about that. It just makes it a lot easier, and it's a lot safer for the patients as well, caring for them, things like that. It prevents a lot of, with the beds transferring, a lot of wound ulcers and things like that, and the quality of care for the patient goes up the more technology you have.
And
So
that's wonderful because you have patients from any age
we do
up here.
It's all adult, of course, but varying from 18, 19 all the way
Right.
up to 90 to 100. We have all variety of ages.
Yeah, and so you have to be equipped to be able to handle that.
that's
And
right.
so, and if they're incapacitated or what, you know,
Yeah.
you have to be able to be equipped. And so, and you all definitely are.
Yes.
All right. Well, you don't have to make this bed shake for me.
Okay. You sure?
I mean, would it be?
Maybe a little loud. I don't know.
It may be a
Can't
little
really
loud.
take it.
No, I'm good. I'm good. All right, we'll be back in just a moment.
Okay,
Thank you.
Thank you.
You know, ladies and gentlemen, this has been such a wonderful day. You know, Mandy, thank you for
welcome.
showing me, you know, what takes place here. What was painful is off camera when she had to take the
The
monitor.
glue on the. The glue is always the worst part. That's
I
the
was
tape.
like, ouch. But you know what? What you do is crucial, and how you do it is, you know, extraordinary. So we thank you very much.
You're welcome.
So Mandy, we're going to close out the show. Is there any last things that you want to say, just to make sure, or any message you'd like to give to the people out there in the community about the work that you all do here?
Well, first, if you ever come in the hospital, one of the most important things is we're trying to teach patients, always ask questions. If you ever have any questions about your medications or any of the care that you're getting, we'd like to hear your opinion on it. That's the only way that we improve given our quality of care. So we really do like to have feedback from the patients as well.
Very good. And we hope that you all have learned something from this and to give you a better understanding about the critical care unit. Mandy Sweat, thank you
You're
so much.
welcome.
You made me sweat just a little bit, you know, with this. You know, it all comes, you know, it kind of really hits you at home, you know, if you've experienced some things personally within this unit with family members, loved ones, or even yourself. And so, thank you again.
welcome.
Ladies and gentlemen, that's all the time we have today for Real Talk, a day in the life of a nurse. Today it was the critical care unit with Tammy and Mandy. Thank you all so much. Thank you all so much for watching. God bless you and your families, and please keep watching.